We're going to demonstrate the skill of NG tube to low wall suction or to suction. First thing we're going to do, of course, is assess our patient. We'll check their name, their medical record number. This patient's name is James Anderson. His birthday's 3/1/2000. So we'll check that against our chart. Mr. Anderson, you're going to get an NG tube put in your nose today that's going to empty your stomach. It may not be very comfortable at first, but it will make you feel better once it's in. You won't have any more throwing up. I'm going to go ahead and raise Mr. Anderson's bed. And we're going to go ahead and check his nose while I'm doing that. We'll look in both sides of his nose and see if anything's occluded. We'll pinch this side. Breathe through this side of your nose, please, Mr. Anderson. Pinch this side. Breathe through this side of your nose, Mr. Anderson. To make sure, once we put an NG tube out, we're not decreasing the amount of air he can get. We'll go ahead and listen to his bowel sounds. This is part of our assessment for NG tube placement. And of course, bowel sounds may or may not be active ×4 quadrants. That may be why you're putting the NG tube down, is because there's either a bowel obstruction or the bowels aren't working like they're supposed to be. Go ahead and put him all the way up. And I'm going to go gather my supplies. To put an NG tube in, you want to have some tissues. You want to have an emesis basin, because sometimes it makes people gag. You're going to have a cup of water, because there's going to be times during the procedure that he's going to have to drink water. You're also going to have a suction canister set up in the room, and suction set up in the room. So, like I already said, we've checked orders. We've checked our patient. We know he can breathe out of both sides of his nose. He doesn't have any fractures or anything occluding either one of his nares. So, we're going to use the right side. And we're ready. We're washing our hands. Cutting us a piece of tape. And now we're going to measure. We're going to measure from the tip of his nose to his earlobe, down to his xiphoid process, which is at the bottom of his breastbone. And we'll take a little tiny piece of tape and put there. Or you can mark it with a Sharpie, or you can look at the numbers on the tube and see what the number is. But you want to make sure whatever you mark it with is something that won't be rubbing against his nose. Okay, Mr. Anderson, I'm going to put this tube down your nose. Like I said, it will make you feel better. When it gets to the back of your throat, I'm going to ask you to take some drinks of water. And that will help it go on into your stomach. There. I guess that's as far as you go. Wrap this around our finger a little bit to make a little curve in it. Now, let's put some gloves on. Put in your lubricant. And we're getting ready to start putting it in his nose. Okay, well, like I said, it may be uncomfortable for a little bit, but we will try to make it as painless as possible. You want to push it back, straight back towards their ear. You may have to do a little turning on it to get it to advance. When you get to the back of their throat, maybe take a little break, give them a tissue, wipe their eyes, because it can make you gag and make your eyes water. Okay, Mr. Anderson, the next step, I'm going to have you take some drinks of water as I advance this past the back of your throat. So hopefully you'll have somebody help you. Drink of water. That's a big swallow. As he swallows, you advance slowly. calmly. Okay, stop for a minute. Give him a little break. Take another drink and advance till you get to your number or the mark that you made on your tape. Once you get to the mark, you can take that piece of tape off. Like I said, you're going to have enough tape to deal with. And go ahead and tape this to his cheek till you verify placement. Now, there's a chance it's going to start sliding, so do not take your eyes off of it. Now, historically, the way you checked NG tube positioning was by putting a stethoscope on their abdomen, taking a little puff of air and pushing it through while listening. And you'd hear something like, you could really hear it in their stomach. And then you would aspirate contents. If it's green looking contents, you know you're in the stomach. Evidence-based practice says those are not the best methods. The best method is at the bedside, draw out enough stomach contents, put it in your emesis basis, or squirt it directly onto a pH strip. And pH should be like around 2 for gastric contents. So we verified placement. We're going to go ahead and connect to suction. If not, this is going to start pouring green stuff all over the bed, most likely. Bless you. So I'm going to hook this here. Like I said, if not, there's a chance that this is just going to start draining emesis, green drainage all over your bed. So now we can go back, now that this can't drain, and reattach the NG tube to his nose. Like I said, it's split here. And we can wrap each end of these around the tube. Now we're going to connect our suction. We check our doctor's order. It says low wall suction. So we're going to assume that means continuous suction. So you turn your suction to continuous or regular, and you would turn this knob. And when you turn this knob, this will go green. Green to yellow is going to be low suction. When you turn this, this will turn, or this will go up to whatever level of suction you need. That would be something for you to document. The tube at this time should start draining. Usually, NG tube drainage is going to start out green. It's going to come into your canister. Your canister has to be set up appropriately. This part goes to your patient. This part goes to suction, to the wall. This part goes to your patient. This is the port you will use. You open this every shift and empty and record the drainage and dispose of it in the commode. You've got to make sure, if you have several ports like this and you're wanting this section to work on this tube, all of these have to be shut or you've wasted your time, because this won't work. It won't suction if there's like a empty one sucking in air. Reassess your patient. Make sure you check their nose, and frequent assessments past this, and make sure this stays where it is. You need to document what number you put it into so that your following nurses can check to make sure it's at the length it needs to be. Because if it's not at the length it needs to be, it's not in their stomach, most likely. Clean up your mess. Document, and